Welcome to the debate. Imagine a massive, intricate filtration system for a city's water supply. You trust it, right? You expect it to catch the impurities and, deliver something life-sustaining.
Right, you just assume it works.
Exactly. But what if someone tells you those filters are actually adding toxins to the water? And worse, what if the local government passes a rigid law saying you absolutely must drink it, regardless of how it affects your own unique biology?
That tension really perfectly captures what we're looking at today. We are essentially putting modern clinical epidemiology on trial, and we're using a very unexpected lens to do it: ancient texts on natural law and governance.
Right, we're asking a fundamental question. Do governing bodies, or really those in power, have the right to impose healthcare mandates based on biomedical research that, well, is often statistically flawed or financially compromised?
And furthermore, does imposing these systems constitute a dharma? A fundamental disintegration of natural order and morality? I'll be arguing that yes, it does. Governments, or historically kings and dictators, simply do not have the right to impose laws based on research papers that claim to harm humans, especially knowing that the results are not 100% accurate.
And I will be taking the opposite stance. I'll argue that evidence-based medicine, or EBM, despite its empirical imperfections, remains our most objective, dharmic framework. Especially when guided by modern tools like AI, it establishes order, it protects public health, and it prevents systemic chaos.
But institutionalizing flawed, financially compromised research into rigid mandates strips patient autonomy. It marginalizes vulnerable lives. Enforcing that kind of compromised data from the top down makes the current application of EBM fundamentally adharmic.
Look, EBM was originally designed to save medicine from arbitrary, unproven interventions. In ancient Sanskrit texts, Dharma is the cosmic order that sustains life and prevents collapse. Establishing clinical guidelines is just a modern function of that order.
A modern function built on hypothetical assumptions that scientists have frequently disproved.
Single studies have flaws, yes, but iterative science, combined with AI systems like Dr. Maya, allows us to combat literal existential threats. We have to look at the pros and cons of medical research on the entire ecosystem. Take antimicrobial resistance, or AMR. Without evidence-based structures acting as a safeguard, we fall into absolute medical entropy. AMR doesn't just affect us. The pros of enforcing medical research guidelines protect plants, animals, aquatic life, and the environment on Earth from being devastated by superbugs.
Itself is heavily influenced by the pharmaceutical industry. The foundation of EBM isn't some pure pursuit of cosmic order. It is deeply, deeply compromised.
Are you saying we just throw out the entire concept of medical guidelines because of industry funding?
I'm saying the math itself is compromised. Look at Johnny Onididis' landmark analysis. He basically proved that most published research findings are false.
Well, false is a strong word.
But it's accurate based on his work. And it's not just honest mistakes either. It's driven by bias, study power issues, and things like p-hacking.
Wait, before we move on, let's make sure we explain p-hacking for the audience. This is essentially when researchers slice and dice their data 100 different ways until they find one random, statistically significant correlation, and then they publish that as a breakthrough.
Exactly. It's statistical manipulation. And add to that the JAMA findings demonstrating that industry-sponsored research draws pro-industry conclusions 260% more often than independent research.
That is a staggering number, I'll admit.
Right? 260%. How does that happen? They aren't usually faking the data outright. Instead, they design the trial to ensure a win, like testing their new drug against an intentionally weak dosage of a competitor's drug.
I see where you're going, but
let me just finish this point. Those in power use these papers to establish guidelines they believe are in the best interest of humanity, but these papers often just suggest associations based on flawed data. Legally binding doctors and patients to a system built on financial conflicts is the definition of a dharma.
But that's exactly why the systematic review process exists. Single studies, especially early phase ones, absolutely contain impurities, But when you do a systematic review, you pool the data from dozens of studies.
Assuming the pooled studies aren't all industry-funded,
Well, you mathematically weed out the poorly designed ones, you cancel out the statistical noise, and you find the actual signal. Recognizing human bias is exactly why we are developing tools like artificial intelligence to synthesize massive data sets objectively. The flaws in the literature don't mean we abandon the scientific method. They mean we refine our filters.
The problem isn't just the filter, though. It's the enforcement. The translation from, flawed average data to state mandate is where the real harm occurs. Clinical guidelines are essentially being weaponized by the state to ignore the individual human being.
Weaponized? That seems like a stretch.
It's really not. Look at the legal case of R versus Thanet CCG. A woman was denied oocyte cryopreservation, egg freezing, before undergoing chemotherapy.
Right, I'm familiar with that case.
Why was she denied? Because the authorities rigidly applied a local policy based on NICE guidelines. They completely ignored her unique clinical exception simply because they refused to depart from the text. The guideline became a legally binding mandate that destroyed the doctor-patient relationship.
I understand the frustration when a guideline feels restrictive. Truly, I do. But guidelines are essential to prevent the catastrophic misuse of finite medical resources. Let's go back to antimicrobial resistance.
Okay.
We are seeing massive agricultural and human misuse of antibiotics. This isn't just a human issue. As I mentioned earlier, these resistant bacteria pass through the food chain. They devastate the lives of plants, animals, aquatic life, really the entire ecosystem. Government enforcement of guidelines is the only way to stop this.
But what does that enforcement actually look like in practice?
Well, it looks like systems like the Prema kiosks. These are automated diagnostic and dispensing stations being developed to strictly follow EBM protocols, like the WHO AVAR protocols.
So, machines handing out drugs?
Machines that physically prevent antibiotics from being overprescribed based on a doctor's gut feeling or a patient's demand. Look, if we don't strictly enforce these guidelines, we are looking at a projected 10 to 16 million deaths annually by 2050 from superbugs. We need systemic enforcement to prevent a global biological collapse.
You keep talking about saving millions of lives with these strict AI and kiosk guidelines, but we really need to look at exactly how your system calculates the value of those lives. It uses a terrifying metric called QLYs, or Quality Adjusted Life Years.
I mean, QLYs are an economic tool for resource allocation.
It's a tool that mathematically devalues the lives of individuals with disabilities. Let's explain the math here for a second. A year of life in perfect health equals 1 QLY. But if a patient has a chronic illness or disability, the system assigns them a fraction of a QLY, say 0.6.
Which reflects the reduced quality of life, economically speaking.
Economically speaking, sure. So if a government is deciding whether to fund a treatment, the math literally dictates that extending the life of a disabled person is less cost-effective than extending the life of an able-bodied person. This is a purely empirical reduction of human life. The state uses that exact formula to deny care.
CALIs can be a blunt instrument, yes. I won't defend every application of them. But we live in a world of finite resources. If we don't use evidence-based allocation, what's the alternative? A system driven by pure emotional bias?
Person-centered care is an emotional bias.
Or worse, a system where the wealthy just buy whatever care they want, leaving literally nothing for everyone else. That would be far more destructive to vulnerable populations. And EBM is evolving past CALIs anyway. We are moving toward MCDA, or multi-criteria decision analysis.
Which is just another acronym to justify rationing.
No, it's a mechanism that actively weighs nuance. Instead of just looking at a single crude cost-effectiveness number, MCDA evaluates patient-centered outcomes, the financial burden on the family, the severity of the disease, and the quality of the evidence. We are refining the metrics, not abandoning the need to measure altogether.
Refining the metrics doesn't solve the philosophical rot at the core of this, though. You brought up Dharma earlier as cosmic order. In ancient Indian philosophy, true Dharma is the natural sustaining order of existence.
Exactly.
But Adharma is entropy, yes, but it is also the violation of natural law. By imposing top-down laws based on hypotheticals and financially tainted data, governments are conquering free will. They treat patients as statistical objects rather than persons.
I don't think that's a fair characterization of public health.
It's an authoritarian imposition that echoes the patriarchal control criticized in texts like the Mahabharata. It forces an unnatural control that is fundamentally adharmic. You can't just mandate healing through compromised math.
I have to completely disagree with your definition there. Adharma is the disintegration of order. Total medical entropy is what happens if every doctor just guesses at treatments based on their own isolated, biased experience.
It's called clinical judgment.
But human judgment is flawed. Look at Dr. Kadayali Srivatsa's vision. He is explicitly using the principles of Dharma in modern healthcare through the Dr. Maya AI system. This proves that structured, evidence-based systems can be deeply ethical.
By using an AI?
Yes, because they restore order by providing equitable, accessible triage and stopping the chaotic spread of disease. Dharma isn't just the freedom to do whatever you want. It is the structure that prevents collapse. EBM is the modern mechanism we use to maintain that structure.
A mechanism funded by pharmaceutical conglomerates and enforced by state mandates is not a cosmic order. It is an artificial cage. Authors, philosophers, and scientists have identified these errors in medical research publications over and over. Ignoring those errors is the real adharma.
Well, let's bring this to a close so our listeners can weigh the arguments. While the biomedical research base is imperfect, and I agree it requires constant scrutiny, it provides the only viable objective framework for governments to manage public health. When we augment it with transparent technology like AI, evidence-based guidelines act as a modern dharma, holding society together against the entropy of disease and unchecked medical practice.
And my position remains that replacing person-centered clinical judgment with state-enforced, statistically flawed, and industry-funded guidelines is a dangerous overreach of power. True healing has to respect the autonomy and unique context of every living being. Enforcing compromised data from the top down is the absolute essence of adharma.
We both definitely acknowledge the profound difficulty in balancing the need for systemic public health order with the imperative to protect individual autonomy and human dignity. Examining modern scientific structures through this ancient, stabilizing lens of Dharma really reveals just how deep these questions go.
It really does. And there is certainly much more to explore in the intersections of science, ethics, and governance within our source material. Understanding how we define both evidence and order is absolutely essential to ensuring medicine actually heals rather than harms.
So next time you think about that city water filtration system, ask yourself not just what it is filtering out, but who programmed the filters and whether you truly have the freedom to choose what you drink.